Welcome, everyone. And this is a great occasion for the Bascom Palmer Eye Institute family because we have one of our family members that has come back to help continue the tradition of this great institution by looking at possibilities of providing an endowment that will particularly study a group of patients that were very dear to the founder of the Bascom Palmer Eye Institute, Dr. Ed Norton. So welcome everyone for joining us at the Mark Daly Inherited Retinal Diseases Center inauguration. I want to extend first warm regards to Mark and Karen, who are sitting here in the front. Thank you so much for coming to very, very warm Florida at this time of the year to be able to do this, but we needed to get this ribbon cutting ceremony going so that we can say that we are up and running. And I also want to thank a couple of people who are in the audience. One, Dr. Virgil Sklar and Mrs. Dr. Sklar, who's here. And Virgil has been kind enough to be on the Bascom Palmer Board of Governors for now many years. And again, one of our very proud alums that has continued to serve the Bascom Palmer Eye Institute. So thank you so much. And certainly to all of you friends and members, friends and others, and the members of the U Health and Bascom Palmer team who are here. So we are going to symbolically do a ribbon cutting here because we couldn't do it in front of the actual center because we still have the emergency room next to the center, and we didn't want all of you to be all of a sudden signing up as patients in the emergency room. Our residents would have had a heart attack at that point. So we decided just to do a symbolic ribbon cutting here a little later. Next is we're going to hear from our esteemed Dean and Chief Academic Officer of the University of Miami Miller School of Medicine, Dr. Henry Ford, who has been a staunch supporter of everything that happens at the Bascom Palmer Eye Institute. And we couldn't be happier with a dean that not only has helped the Bascom Palmer Eye Institute, but continues to make our medical school rise in the rankings and provide our medical students education that will hopefully continue to be second to none for them. So Dr. Ford, thank you so much for joining us tonight.
I believe that my remarks will be far shorter than the introduction. What a pleasure to be here this evening. So let me say one more time, welcome, and thank you for being here. This is a momentous occasion, and I'm thrilled to be able to be part of it. One of the greatest and most gratifying aspects of my job is the opportunity to meet grateful alumni who become amazing benefactors. And this is who we have tonight in Mark Daly. Such individuals become game changers by supporting discovery science, which when translated into clinical interventions, will help improve the quality of life for our patients and for the rest of humanity. As Eddie Alfonso already mentioned, Mark Daly's generosity made a critical impact on retinal research when he endowed a chair for retinal research back in 2016 at the Bascom Palmer Eye Institute. And now, by establishing a center that is second to none in researching debilitating retinal diseases. The Mark J. Daly Inherited Retinal Diseases Research Center will make its mark both for forward-thinking research and for translating from bench to bedside. On behalf of the University of Miami Miller School of Medicine, I offer my heartfelt thanks to Mark for his vision, for his passion, for his generosity in naming such a center. This is an amazing accomplishment, and thank you for making this dream a reality for us. These funds guarantee that resources will be available for research in perpetuity for our world-class physicians at Bascom Palmer. The Mark J. Daly Inherited Retinal Diseases Research Center has created a place where laboratory science can be translated into medical cures, bringing solutions and hope to patients who otherwise face irreversible vision loss. The center will be a collaborative hub where our gifted physician scientists study and treat debilitating congenital diseases of the retina, ultimately preserving vision and even reversing the effects of blinding diseases. I'm speaking about physician scientists like Dr. Byron Lamb, holder of the Mark J. Daly Endowed Chair in Ophthalmology and director of the center that we are celebrating today. Janet Davis, Nina Barakal, Carlos Mendoza, Danielle Gregori, and other stellar ophthalmologists were inspired daily to collaborate to lessen the affliction of inherited retinal diseases, not only locally, but also nationally and internationally. So on a personal note, we were chatting outside and I asked Mark to say, well, what motivates you to give? And truly the testimonial was worth recording, and I just hated to miss that one. So I'm going to have to conduct a special interview to make sure we capture it. But it's that profound sense of gratitude for the place that helped him become the ophthalmologist that he is today, a place that he views as being central, not only for himself, but for so many others to come. And that's why he is reinvesting in Bascom Palmer Eye Institute. So I couldn't be more grateful as a dean of this medical school to be able to count you among the proud alumni of this place. Thank you so much for your generosity. So please come in and share a few words with us. Mark. Oh, before you do that.
Thank you, Dean. Thank you, Dean. It's wonderful. I wanted to just embarrass Mark a little bit because it's impossible to get Mark to come to an event like this. Mark doesn't like them. He doesn't like photographs. He doesn't like any of this stuff. So Karen, please help him out. Okay, just hold his hand while I say a few things. So, you know, Mark has been an incredible individual. Not only was he a extraordinary student at the University of Illinois, where he did his undergraduate and medical school, but he then came a little south to the University of Florida to do his internship, and then to a little known place called the Bascom Palmer Eye Institute that, as my mentors in Boston had labeled it, was really an academic wasteland, supposedly. But Mark and I knew that it wasn't, and that there were some really unique people here that we really wanted to train with and learn from and be part of this amazing transformative place. So he did his residency and retina fellowship here. And not only was he a superb retina fellow, but he also helped Harry Flynn get through the fellowship because they were fellows together, right, Harry? Harry would have flunked the fellowship had Mark not been there to help him out. During that time, Mark, as inquisitive as he is, named a known entity in retina called torpedo maculopathy. And Mark wrote the initial paper writing about this particular finding and disease of the macula. And after finishing Bascom Palmer, he did what most of the Bascom Palmer graduates do. They want to give back. So he went back to Illinois, and not only to practice retina at the Wheaton Eye Clinic, where he spent his career, but giving back to Loyola University by teaching generations of residents and medical students there. So Mark has been graced with a career that has given him a lot, as we heard from him earlier today. But more importantly, Mark has taught us and continues to give back, which is a great thing to do, which I'm sure is a great satisfaction to him. And we're so happy that he has seen Bascom Palmer as a place to give back to. So we're proud that he's both an alumnus and not only are we proud that you're an alumnus, but you're one of our biggest philanthropists. So thank you so much for what you've done for the Bascom Palmer Institute. So like the dean said, he established the initial Mark J. Daly Endowed Chair in Ophthalmology back in 2016. And that was in itself transformational. It was a chair that was needed dearly at the time because we had to do some very strategic recruitments. And after talking to Mark, after he had initiated a conversation during the 50th anniversary of Bascom Palmer that he wanted to do something for Bascom Palmer, we were able to really use that first chair very strategically to set a program in motion. Not only has Mark been willing to endow a chair and now a center, but stay tuned. There is a second chair coming. The second Mark Daly chair will be announced in the very near future as we continue to look for a potential holder for that second chair. So I cannot thank you, Mark, enough for your willingness to invest in discovery and innovation in retinal diseases, the passion that you develop here under the tutelage of Dr. Norton and Dr. McAmer and others who were here during your time who expressed such a great interest for patients that were suffering with these diseases. So we thank you, and your gift will be a highly impactful gift that will help treat inherited retinal diseases from diagnosis to laboratory work to potential treatments, and also educating the next generation of scientists. So thank you so much. To tell us a little bit more about the center, I want to introduce the director of the center, Dr. Byron Lam, to come to the podium. And Byron, if you could join us. Byron, as you all know, is professor of ophthalmology and the holder now of the first Mark J. Daly Chair. And he will be the director of the center. And as Mark also has, like Mark, he also has a passion for inherited retinal diseases. And we all know of the great clinical and scientific contributions that Byron has made to this field. So thank you, Byron.
So I, of course, want to thank Mark Daly for his contribution and his generosity. I would have to say that everybody I spoke with has always said that Mark has been a terrific colleague, terrific friend, and also a terrific retina surgeon. So I got this also from my brother, Sheridan Lam, who had been practicing in Chicago for a number of years and who has one of the highest respect for Mark. And I think Mark is always inquisitive, fascinated with retinal diseases. And during his busy practice, he has been able to also contribute in the peer-reviewed journals. So I think that's incredible. But I think his compassion and his vision goes beyond the patients in front of him. I think, he has the vision of giving and also really giving impact to these conditions that are really, really severe. At the same time, we have a lot of hope. And his the establishment of this center is also very timely because there's a lot of movement in the inherited retinal diseases research. So IRDs is not just a simply one disease. IRD encompasses, which we all know, this large group of conditions where hundreds of genes and just one single gene, if it doesn't work properly, affects somewhere along the retina pathway, and then there's some dysfunction of the retina. And patients we see could be born blind at birth, like Leber congenital amaurosis. I mean, as a parent, I can't even imagine that. And it can also present in such a way that you have a gradual loss of peripheral vision and night vision and crowding you in and you're a young adult and you realize this is happening to you. And this is almost like somebody who had planned their whole life and career, and boom, there's a hammer on their head. And that is very severe. And I can't imagine that either. On the other hand, I think we have a lot of hope because the first gene therapy for inherited retinal disease was approved in 2017. And Bessem Palmer was among one of the 3 first patients treated in March of 2018. And that's Luxturna for RPE65 IRD. We also have a paper that has demonstrated optogenetics as a proof of concept case in Nature Medicine recently that has showed the effectiveness of treatment even in advanced retinitis pigmentosa. So I think we definitely have a lot of hope there. Gene therapy is not just gene replacement therapy anymore. It is also antisense RNA oligonucleotide, is also gene modulating. Beyond that, there's also CRISPR, which has been in the clinical trials. And also we're going into small molecules where we can, in fact, sort of draw in the stem cells that all of us have as adults into the atrophic retina. So there's so many different strategies that are really important opportunities for us. So we are definitely, very happy with this regard to this gift that Mark has given us. We've been very successful in clinical trials. We participate in over 20 IRD clinical trials. The first patients with choroideremia in the US was treated right upstairs with gene therapy. The first achromatopsia patient in the world that was treated with gene therapy occurred upstairs. We also made great strides in translational research, but we could do better. And I think this is really a great opportunity that you have given us, that we are so grateful that we could be better clinical scientists and advance this field. So really thank you for all you have done.
Thank you, Byron. That's great, exciting work that you're going to continue to be doing at the center. Mark, it's wonderful to be celebrating you, but we want to hear something from you. So if you could join us.
Well, thank you for your kind words. It's my privilege to be here. So I showed up here in 1974 as a 26-year-old young man, fortunate to be accepted at the University of Miami Bascom Palmer Eye Institute. In those days, there was no retinal selection thing like that. You just went around to different places and interviewed. And I thought it would be cheaper if you just stayed at the call rooms at the places you went to, which worked out pretty good sometimes. Like when I came here, they did have a call room and they allowed me to stay there. When I went to Baylor, they just said, we don't really have a call room. You'll have to sleep in the emergency room. So I was worried that I would wake up with an appendicitis scar. But I was so fortunate because I came here at a time when there were giants of ophthalmology. I'll just go over a couple of them that many of you have heard of, but I was fortunate enough to study under Edward Norton, Victor Curtin, Donald Gass, Robert Mockamer, J. Lawton Smith, Douglas Anderson, Richard Forrester. Those were giants in ophthalmology, and they were able to instill a little of their education and knowledge to me. So I've now been in practice for 46 years and things have changed a lot in ophthalmology. I think the 3 biggest changes, one has been intraocular lenses. When I showed up, they were very controversial. We did intracapsular removal of the cataract where you took it out and then didn't put anything back in. Actually, David Kasner taught us at the Veterans Hospital, and I had the privilege of losing vitreous with David Kasner. And he had the insight to realize that you could do something with that vitreous. And he told that idea to a young researcher named Robert Mockamer, who invented vitrectomy, which I think is the second biggest change since when I started ophthalmology. I was very fortunate in that I came just when vitrectomy was starting. Prior to that, if you had bleeding in your eye from diabetes, you were blind. There was nothing anybody could do. And Dr. Mockamer and others invented an operation where you could go in and take that blood out and restore the sight. And I was right at the beginning of that. Harry Flynn will enjoy this. One day they came in and said, there's this fellow out in California, and he says you should make 3 holes in the eye to do 3-port vitrectomy. And we said, isn't that ridiculous? Why would you make 3 holes in the eye when you can do it with 1? And then the third major area has been inherited retinal diseases and genetic diseases. When I was in medical school, genetics was pretty easy. They said, this is going to be sort of quick. If you have 46, that's really good. If you have 45 or 47, that's bad. And that was pretty much our genetics course. And over the last 46 years, we've just had tremendous increase in the knowledge. Now, if a person walks in with inherited retinal disease, there's a 75% chance you can tell them why they've got it and exactly what their mistake is. Our original idea was that if you could figure out these diseases, then you could fix them. So we've been pretty good at figuring out the diseases. The fixing it has been harder. And that's what I hope the Mark J. Daly Center for Inherited Retinal Diseases will be helpful. So after I left the university in '78, I joined the Wheaton Eye Clinic, and I was number 6. And now there's 34 of us. So I've had the opportunity to be in practice with 1 job, and I was able to also work at Loyola University as a part-time professor there for 35 years. And at the end of that, I've had some resources. And as I told the dean, you have a certain responsibility of what you're going to do with that. You want to buy like a really big house? Would a Rolls Royce be nice? Or could you find an institution where if you present them with these resources, they're going to use it responsibly, and they're going to help people, patients in the world. And that's why I've made a gift to Bascom Palmer Eye Institute.
Mark, we couldn't be more grateful to you. Thank you so much. So I'm going to ask Dean Ford and Byron Lamb to join me, where we're going to give Mark back a surgical instrument so we can do a little vitreous extraction here. Single end. Mark with a mark of a surgeon. Thank you so much. And thank you everyone for joining us tonight. This is a ceremony that we've been trying to put together for now several months, and it's always difficult to find the right time for everyone, but this was the right time. And so thank you so much for joining us tonight, and enjoy the rest of your evening. Thank you for being here.